India is a developing nation of the modern world. An independent republic, the demographics are remarkably diverse. According to India's first Social Development Report of 2006, out of 1 billion people, about 260 million Indians are still below the poverty line. In India, there are innumerable people who cannot afford 3 square meals a day. Poverty is hearing your children cry to sleep because there is no food. It is an alcoholic husband, signing away last one fragment of land you live on, for his drink. It is about inaccessibility to education, healthcare and insecurity about the future. The UN Special Reporter on the Right to Food, Jean Ziegler's visit to India in 2006 report stated, levels of malnutrition and poverty remain very high and food insecurity has increased since 1990s. He found India had one of the highest levels of child malnutrition in the world. India ranks a dismal 66th in the 2008 Global Hunger Index. At a time when the economy is growing at an average of 7 to 8%, hunger too is keeping pace with the economic growth.
Education, the fundamental right of the child, is one of the major programs of Hope Foundation. 40 to 60% of Indian children within 6 to 14 years are out of school. Enrollment rate at the primary level is 88% and 59% at the middle level. In India, only 53% of habitations have a primary school and 20% have a secondary school. If every child can avail some kind of early childhood education, the chances are high that the child will then go on to regular school. Moreover, the preschool exposure will enhance the child's subsequent school performance in terms of achievement and attendance. Thus, Hope is running pre-primary creches for underprivileged children. Skilled caregivers provide pre-primary education to the children, preparing them for admission into the government-run formal schools. They also attend to the children's basic needs and provide them with nutrition for proper growth and development. In order to prevent early school leaving, Hope runs guidance coaching centers. The qualified teachers guide them in studying and doing school homework to improve their performance. The organization advocates the issues relating to child rights and protection with local authorities, schools, government officials and other key influential people. Different community awareness camps are being organized in order to sensitize the general public about the rights of the child. Hope extends support through the running of special educational centers and a residential unit for children with special needs. It also supports children who are meritorious, studying in school or college whose families cannot afford the cost of education.
Children are the worst sufferers. More than 75 million children suffered from malnutrition, in which a massive 14.4% have not received single vaccine. 45% children below 3 years are severely and chronically malnourished. 52 out of every 1,000 children in a year die at their birth. 380,000 deaths occur each year due to deficiencies of vitamin A, iron and iodine. 800,000 children die from preventable disease like diarrhea. Indian women often endure ill health without complaint. 100,000 Indian women die of pregnancy-related causes each year due to nutrition and health status, number of children, gender disparities, socio-economic conditions and poor access to health services, etc. The Hope Foundation is responsible for facilitating the improvement in the health status of the street and slum-dwelling children and women of Kolkata, by providing accessible and equitable primary health care services. It intends to implement through health clinics, improved health awareness, and easy access to drinking water and sanitation facilities. Generating awareness on different health issues is also one of the major focuses of the organization. Hope provides emergency physical and psychological support to the poor and distressed, suffering from different communicable and non-communicable diseases. It networks with the local police, hospitals and rehabilitation centers, and operates 24 hours a day and 365 days a year, for the rescue of abandoned, trafficked children or women, injured people in road accidents and mentally ill people on the street, and repatriation of rescued victims. Hope runs a specialized hospital for the underprivileged children, with a capacity for 30 beds. The 4-story building includes a polyclinic and diagnostic center, a pathology department and an X-ray department. It provides specialized treatment to the poor orthopedically handicapped children. The organization also provides special care and treatment to the pregnant or lactating mothers and infants, who are either infected or affected by HIV/AIDS.
There are 17 million children working as child labor in India. 85% of child laborers are engaged in the unorganized sectors and 80% in agricultural work. 25% of sexual exploitation occurs below 18 years of age. Mentally or physically challenged children are particularly vulnerable to violence and abuse. Hope runs an integrated program for at-risk children in the vulnerable pockets of the city. These children are identified and protected by providing medical assistance, counseling, education and recreational facilities. The aim is to eliminate child labor, protect children from abuse, rehabilitate drug-addicted children, and ensure children's rights. Hope also has 7 protection homes for these vulnerable children. To ensure gender parity in the community, uplift living conditions, and develop savings habit, Hope ensures that funds are available for an alternative source of living, after a training course in specific trades like knitting, tailoring, fabric, embroidery, bakery etc. for marginalized women.
The Journey of the Hope Foundation, an Irish charity, started on February 1999, with the primary purpose of raising efforts for underprivileged children, to give them access and rights to education, healthcare, protection and nutrition. It jointly works with grassroots-level partnered organizations to address issues that directly or indirectly affect children and women. In its journey of 10 years, the organization has served numerous people to improve their quality of living, and has also been honored with many accolades and recognitions. This would not have been possible without your kind support and continuous involvement. Let us all join hands together, to add little happiness and colors into the lives of the distressed people around us. Thus, Hope Foundation invites everyone, sensitive to the cause, to extend their helping hands, to share, to donate, to volunteer, and to take proactive actions to help the Foundation achieve more successes in the days to come.